Well, when Theresa May became PM, she promised to tackle the burning injustices in society and demanded public services explain or change racial inequality. Health was one service highlighted in the government's racial disparity audit. It found if you're a black woman, you're 7 times more likely to be sectioned than a white woman. Jane Dodge has been to an event in Leicester aimed at tackling those inequalities.
Hello, good morning.
At 73 years old, Bernard Francis has finally decided to get tested for type 2 diabetes, which is usually related to lifestyle. If you're black or Asian, you're far more likely to develop the disease.
This is a copy for you to take home. I wrote down your sugar level here, 5.4.
The diabetes awareness bus was just one of several services on offer at a health fair in Leicester this week. It's not just diabetes that's more prevalent in black and Asian communities. So is sickle cell disease and prostate cancer and mental health problems. And the organiser of this event says people aren't getting the help they need.
What organisations need to do, and the powers that be, is to target so they know where the gaps are. They know who are not accessing services until they're at crisis point. It's about target those groups. Target them and ensure that we're addressing their needs at that early stage before they get to crisis point.
Leicester is the only place in the country to have a centre for black and ethnic minority health. It's found that the stigma attached to issues like mental health can be far stronger in these communities.
It's about privacy and it's about maintaining personal dignity and the confidentiality. If you're suffering from ill health, including mental health, there is a tendency to want to be insular about keeping that confidential.
Sherelle Agostin has found even when you do seek professional help, the response can be patchy. She has sickle cell disease. It's the most common genetic disorder in the UK, and most people who have it are either from African, Caribbean or Asian backgrounds.
Sometimes the specialist services are getting closed down, which means there's more pressure on general services, and we find that doctors don't necessarily know how to treat sickle cell. And it's something that I'm really passionate and scared about, actually, for the future of children growing up with sickle cell.
Closing specialised services is a false economy, according to community health campaigners. They say invest in raising awareness now and you'll save money in the long term. Back to Bernard Francis.
They say I got to cut out a lot of the sweet stuff and things like that, and I love sweets, so that's going to be my hardest bit, but I can start doing some walking and exercise.
The good news is he's not got diabetes. The bad news is he's got to lose weight.
And Pamela Campbell-Morris, the health campaigner who set up that event in Leicester, is here with us now. Welcome to you, Pamela.
Thank you.
So how serious are the problems of inequality in the way that the people are getting treatment for health problems or not getting treatment for health problems?
The problem is very, very hard. So serious that, as we know, Theresa May have mentioned it this recently. Yes. For decades, this has been the issue, and to hear it come around again, it shows that it must be at crisis point, because a report like that has been around for quite a long time. The achievement of young black men. I would like to really focus on the overrepresentation of black people in the mental health system. Yes. Also employment, black people in higher position, for example, in the NHS Trust. Bearing in mind overrepresentation in the mental health system and the lack of representation at senior level, that is a serious issue in itself. We talk about maybe, for instance, the fire services. Look at how many black people have been in sort of higher positions in those.
Let's talk about the health problems and how much of a problem they are. People are obviously getting ill. How ill? I mean, are people dying?
Oh, people are dying, and people are entering into mainstream services when they're at crisis point. Now, for me, the issue is about awareness, it's about education, but it's about mainstream organisation having an understanding and getting a grasp of the issue in itself. And I know that we've got your MPs here, so I spoke about the overrepresentation of mental health, black men in the mental health system. I'm not sure how much aware you were of this and what you plan to do about this.
Well, maybe we can start with Neil O'Brien. What would you think your party should be doing about this? What should government be doing?
Well, the first thing I'd like to say is just to pay tribute to Pamela for the work that she is doing, trying to address these issues and helping people to come forward for treatment. You're right. I mean, I think this race disparities audit is a really brave thing of the Prime Minister to have commissioned. It's a personal passion of the Prime Minister's, and it's thrown up some really frightening statistics. So you mentioned this. If you are from a black African background, you're 10 times more likely to get sectioned under the Mental Health Act. So that's why the Prime Minister, you saw at Conservative Conference...
You say it's a passion of hers, but what's going to be done to help this situation? And will you be putting more money in, and where will that money come from?
So let me give you an example. One of the things that has turned up, this audit that she commissioned, is that if you're from a black or minority ethnic background, you are going to find it twice as hard to get an organ transplant because people aren't coming forward at the moment. And that is why I think the Prime Minister is right to... the other day she said that we would move potentially to a system, or we're going to consult on moving to a system where instead of having to opt in to be an organ donor, you opt out. Now that's a controversial idea. It's a big controversial debate we've got to have. But personally, I think it's the right thing to do because it will mean more people's lives are saved and it will help particularly people from black and minority ethnic backgrounds.
Pamela says that this is a problem that's been going on for decades. What could the Labour Party do to help?
Well, I think we just heard the question of resources being ducked. I mean, at the end of the day, what's going to happen is with the NHS under the pressure it's got, it's the sorts of exactly community services which give access to black people and many others to the health system that's going to go as the concentration goes on those services that are provided for people in crisis. You can't ignore that. It's a resource issue.
For me, I heard you talk about the commissioning that the government have done in commissioning that report. It's waste of money because this reports into these issues have been ongoing for decades. So what I would like to know is why waste money on more report? The African Caribbean people are one of the most researched group of people, and yet more money has been plunged into a report telling the government and yourself something that is already been evidented instead of putting the resources into voluntary sector organisation, into community organisations, to support those individuals before they get to crisis.
You want action now,
We want action now.
So overall, we're increasing the NHS budget by £8 billion. Its budget is going to go up in real terms. So I'm not ducking the issue of funding. Funding is obviously crucial, but we need more than the increase in funding that we're making. We also need to get behind good community groups like the one that you're running. And as I go around the Gurdwaras and the temples and so on in my constituency, the NHS in our area, in Leicestershire, are doing some fantastic things. There are services to try and get more people to come forward, to help people. You mentioned how the black and Asian communities are more likely to end up with diabetes, to identify that problem. So good work is being done. We clearly need to do more, and we are putting in more money.
But what you've just said is totally ignoring what that package has just said. Where it's political waffle. People on there are saying their community services are being cut, therefore they can't support the sort of work that's being done to try and enable more black people to access mental health or more black people to access some of the other services.
So what would your party do then, Vernon?
Well, it needs more resources rather than pretending there's more resources.
But where are the resources going to come from?
Well, we've laid out how we'd actually get more resources in. But at the end of the day, what the NHS at the moment is facing, you either put the money into the front line, and to do that, you have to cut the community resources. And that's a bad thing to do.
How's the future looking to you when you hear what's being said
here? The issue
here?
for me is not about spending more money all the time. It's about speculating to accumulate. Because unless you're sort of addressing the issue of early intervention and prevention, then it's going to cost the NHS more. You talked about the temple and so forth. What must be recognised, for instance, you alluded to Leicester. Leicester is very diverse. You've got BME communities within the BME. And what we need to be doing is looking at each BME community specifically. For example, I know, and I will keep repeating that, because the issue of overrepresentation in the mental health system is primarily African Caribbean men and women. So I'm not going to cloud the issue and say BME. We need to, and as politicians, you need to be ensuring that you're addressing the issue specifically. One glove does not fit all.
Pamela, you couldn't have been more clear about how much action you'd like to see. Thank you very much for coming into the studio.